Everyone deserves to be happy. Happiness is the highest form of health, and health and happiness begin with you. Do you know the many secrets to happiness? Today we will talk about the V's. The female reproductive health system consists of the uterus, the ovaries, the cervix, fallopian tubes, and the vagina. The least discussed and talked about topic amongst women and friends is the most intimate part below. Why intimate? It is defined as something private, close, and personal that certainly belongs to no one else but you. It is an expression of our femininity that distinguishes us from the males. It plays a part in our capacity to reproduce from childhood and childbearing years. Without the V's, we will all be miserable and unhappy. And like any part of the body, the V's winds down and ages, and it is the most vulnerable to aging because it cannot hide the truth. Intimate refers to our V's. Do you know how many V's we have in our body? I won't be surprised if many of you are confused with the V's in your body. We actually have 2 V's, and a little anatomy will help better understand what these are. When you spread your thighs, you will see the first V, the vulva. It is collectively referred to as the female external genitalia or the female sex organ, which differentiates us from the male. In a lying or a standing position, you have a mound of fat called the mons pubis. As one moves down on either side of the vulva, prominently you will see the most visible structure known as the labia majora, or the large lips or cheeks with hair that partially or fully hide other parts of the vulva. The hairless labia minora or small lips are found within and partially hidden by the labia majora. Normally, these folds or lips do not go beyond the labia majora. The vulva is divided symmetrically with one side of a mirror image of the other. It is divided by important midline structures that play a big role in the vulva. The first midline structure is a clitoris, where the labia minora meet at the front of the vulva, and they're partially hidden or covered by a hood or a cape of tissue similar to the foreskin of males. This area is rich in nerve tissue and is suited to sexual stimulation. Further down, as one opens the inner labial folds or the lips, you will find 2 important openings. The first is a pinpoint opening called the urethra. This is where urine is excreted after passing from the bladder to the urinary opening. As you go further down midline, the second structure that you will see is the vaginal introitus, or what we call the vaginal opening. Remember, this is not the vagina. This is a vaginal opening that actually is the external communication of the vaginal canal into the internal reproductive system. Lastly, the area right underneath the vaginal introitus or opening is called the perineum, which provides the muscular support of the vaginal canal internally and ensures a barrier protection between the vaginal opening and the anus. So I must emphasize, the vulva is not the vagina, and the vagina is not the vulva. What better way to understand this first series but to take a peek, assess, and evaluate your intimate V. I'll see you in my next VChat series, The Secrets to Be Happy. Hello everyone. This is the most interesting of my VChat series, The Two Faces of a Woman. Happiness is the highest form of health. I keep saying this because health and happiness begin with you. I've spoken about the secrets to be happy, but this time, how does one show her happiness? Happiness is manifested generally in our faces. When we have nice smiles, we are bound to be energetic, charming with radiant glowing eyes, and yet, are our intimate V's really happy? So to better understand the happiness experienced by our V, let us now understand that each woman is endowed with two faces. One externally, where the whole world can see it, and another one that is intimate, called the face down under. So if your face is happy, we should always think that our intimate face down there is also happy. Your intimate V is happy when it is manifested in your external face and your eyes. Okay, let us begin. So your external face up here, our face down under, is the vulva. The vulva has a forehead, but it doesn't have eyes and eyebrows. Down on the side is what you call the labia majora, or the larger outer lips, all right? And the difference is that it is full of hair. Now, the crease between the cheeks and the base of the nose is where you will find the inner lips, or the labia minora. Like the face, our face down under is also symmetrical, where one side is a mirror image of the other. The only difference is that our face externally has midline structures that divide the face into two. The first midline structure is the bridge of the nose, which the face down under also has the clitoris, which is hidden between the two labial lips. Further down, you will find the tip of the nose, which is actually the area of the urethral opening. And further down midline, you will find the mouth, which is the vaginal opening. Now, our face has a chin. Our face down under also has a chin that provides the support of the vaginal structures, and we call this the perineum. That provides a space between the vaginal opening and the anus. This is an example of a normal-looking, youthful vulva with no wrinkles, no creases, no discoloration, and tissues are symmetrical. There are no excess folds from the labia minora that extends to the labia majora. The midline structures also will show you a pinpoint opening, that is the urethral opening, and the vaginal opening, together with good perineal support. Remember, there are no labial minora excess folds that protrude into this schematic diagram. This is an example of the vaginal opening that is at its virginal pre-pregnancy state. The hymenal ring here in this picture is visibly seen. The perineum, which is again the undercover underneath that vaginal opening, is that area that separates the vaginal opening and that of the anus. Remember that the perineal body is well formed and well supported. So remember that like any female body that goes through a biological winding down During the process of aging, our V's are most vulnerable. Women will go through great lengths just to make their external face look younger, but they don't realize that their intimate face down under is lagging behind. Remember that as you age, your intimate face will manifest unhappiness, even if your happy face up there will manifest all the glows and all the smiles. Remember that your intimate V's down under cannot hide the truth. So, to continue with my V-Chat series, I'd like you to stay tuned because I will talk about the science behind an intimate makeover.